Bismillahirrahmanirrahim. Assalamualaikum dan selamat pagi pada semua yang hadir pada program syarahan awam Ungku Aziz Siri 1 2025. Okey, perkenalkan diri, saya Suhailah Binti Saleh, penolong pendaftar Pusat Pengajian Pembangunan Ungku Aziz. Bersama saya moderator hari ini adalah Encik Izzudin bin Mohamed, merupakan pegawai penyelidik Pusat Pengajian Pembangunan Ungku Aziz lah. So, saya rasa kita boleh mulakan kita punya public lecture pagi ini. Saya serahkan kepada Encik Izzudin.
Assalamualaikum. Terima kasih Puan Su. Okay, I will start now. Assalamualaikum and a very good morning to all. My name is Muhammad Izzudin and I will be the moderator for today's session. Welcome to Ungku Aziz Talks and Public Policy, Public Lecture Series 1, 2025. For your information, this program is introduced by Ungku Aziz Center as a tribute to the late Royal Professor Ungku Aziz in recognition of his contribution and efforts in the fields of poverty and development in Malaysia. With me today is Dr. Sharifah Fatimah Alzahrah Binti Syed Hussien Al-Atas, an assistant professor of sociology at the International Islamic University Malaysia, a sociologist, an academician, a dedicated advocate for women's rights, and also my respectable lecturer from a few years ago. I'm glad to have you here, Dr. Fatimah. Dr. Fatimah, while being an assistant professor, she also coordinates the unit for social issues and development advocacy and research. Additionally, she is an associate fellow at the Ungku Aziz Center for Development Studies at the University of Malaya. She specialized in the sociology of marriage and family. Her research interests encompass social cohesion, inequalities, gender, and family dynamics, and she has actively participated in various research projects related to these themes. Dr. Fatimah has worked on several transdisciplinary research projects to address critical social issues and has served as a consultant for national and regional level projects. She frequently engages with the public through media appearances and community programs, advocating for critical issues such as menstrual poverty. With that being said, the topic for today is period poverty, the intersection between multidimensional poverty and gender inequality. When we think about poverty, we often focus on the lack of money. But actually, poverty is much more than that. It's about access to basic needs, services, education, and opportunities to live a better life. One important aspect that is often overlooked is period poverty, the inability to afford or access menstrual products, which can severely impact a person's health, well-being, and their daily life. So, Dr. Fatimah, that was just my general impression on period poverty. I believe you are more of an expert on this matter. So, can you explain what is period poverty and maybe enlighten us on the topic today? Yes, please, Dr. Fatimah.
Bismillahirrahmanirrahim. Wassalatu wassalamu ala asyrafil anbiya'i wal mursalin wa ala alihi washabihi ajma'in. Good morning, everyone. Thank you so much, Izzudin, a dear student, and also very proud to see your progress and growth. Alhamdulillah. So, I will try to get through defining period poverty and then also discussing on the intersection of multidimensional poverty and gender inequality. So essentially what I'm presenting today is a framework of looking at menstrual poverty or period poverty and seeing the intersection between these two concepts of the multidimensional poverty as well as gender inequality. So we know that women make up half of, or almost half of the world's population. That means there's about 3.9 billion of us. And at the same time, most women and girls will go through menstruation as part of a healthy biological growth and process of our lives. And we menstruate, or we go through the menstrual cycle on an almost monthly basis, and we experience it for about 30 to 40 years of our lives. So menstruation is a very significant part of women's lives, and women make up half of the world's population. And so at any given moment, we have about 800 million women and girls who are menstruating. So this is definitely not a small issue, nor is it an issue that only affects small groups of people. So when we talk about menstruation, it's a significant part of human life. And of course, to acknowledge that all of us come from the menstrual process, because we all came from our mother's womb and our mother's uterus, which had to go through the menstrual cycle. So this is an issue that affects all of us actually, and we should all pay attention to it. So even so, not all women and girls who experience menstruation, according to Boble, have similar experiences or the same experiences of menstruation. And then, of course, we don't all have the same access to the needs we require to take care of our menstruation. So, and then at the same time, we don't all live in the same country with the same cultural context or social environment. So all of this also affects how we experience menstruation, the resources we have, and also the social cultural context that we live in, including the political and economic context as well. So Izzudin asked me, what is period poverty? I hope at this point, many of us are familiar with this term menstrual poverty or period poverty. And often it is used in a colloquial way to mean a lack of access or an inability to maintain menstrual health and hygiene. I did find, there is a definition given by the American Medical Women's Association to say that menstrual poverty or period poverty is an inadequate access to menstrual hygiene tools and education. So here they highlight two things: menstrual hygiene tools and menstrual education, but at the same time highlighting that it is not limited to just sanitary products, washing facilities, and waste management. But I want to actually bring a broader idea or definition of period poverty, because I think it doesn't just require the menstrual tools or health tools and education. In order for women to manage menstrual health and hygiene, they require more than menstrual tools and education, even though it is more than the sanitary products, washing facilities, and waste management. I also want to highlight the importance of addressing the social, cultural, and political factors that then affect the access to the tools and education. So therefore, framing it from a multidimensional poverty framework as well as a gender inequality framework. So that's essentially how I will start the session. So can I go on, Izzudin, or do you have more questions, or I'll just proceed on?
You can just proceed now, Doctor.
All right. So just now I introduced two concepts: menstrual health and menstrual hygiene. And there is a broad body or a large body of research on both menstrual health and menstrual hygiene management, or known as MHM. So menstrual health is essentially a state of complete physical, mental, as well as social well-being. And it's not just the absence of a disease or an infirmity relating to the menstrual cycle, but a complete state. That means the women or the person that experiences menstruation has a complete physical, mental, and social well-being in the management of their menstrual health. And when we talk about menstrual hygiene, so we hear this term menstrual hygiene management. We know that it must have something to do with hygiene, cleanliness. So when we say MHM or menstrual hygiene management, what we are referring to is the practice and the resources that is necessary for women and girls to manage their menstruation in a hygienic and dignified way. So we will look deeper into what do we need when we are trying to manage our menstruation in a hygienic way as well as in a dignified way. And what does dignified mean? So there's a lot of discussion and sometimes differences in arguments about what dignified manner means. So this is also very social in nature and cultural in nature. So when we say menstrual health, we want to ensure that individuals are able to themselves manage their menstruation with dignity, and they have access to necessary healthcare. That means they can go to see a medical professional when they have any menstrual related issues. For example, delayed periods, or maybe the period didn't come for a few months, or there is an abnormal bleeding or an abnormal pain. And this is important and necessary because it must relate to their ability to then participate fully in society. That means it cannot be that because of some menstrual health related issues, they are unable to participate in society. So including being able to go to school, being able to work, being able to join social activities, and so on. So why is it important? Of course, it's a basic human right for women to be able to access menstrual health, and there are discussions on a human rights perspective. Excuse me. And then at the same time, of course, we're all working towards the Sustainable Development Goals. So ensuring proper provisions for women's menstrual health and girls' menstrual health is part and parcel of our shared initiative to achieve the Sustainable Development Goal in more than just one target, more than just gender equality SDG 5, but also in addressing no poverty, access to education, and so on. So what about menstrual hygiene management, or MHM? So we know that an MHM requires three broad areas to manage. So the first one is for the individual to have access to the knowledge for the management of their menstrual hygiene. So this also includes the normalization of the biological process of menstruation, meaning to say that we understand that menstruation is a biological process rather than, for example, beliefs about menstruation being a curse, or that menstruation is a disease, or a menstruation is a spiritual state of being weak or dirty. So it is just a part of experiencing being human or being a female, and that it happens in a form of a menstrual cycle, and that we can understand the processes that are related to the menstrual cycle, including the first arrival of menstruation, that is menarche, and the end of the menstruation, which is the menopause. So often when we talk about menstruation, our focus is always on adolescent or young girls, and the menarche and the first start of menstrual hygiene. And this is really important because a lot of the information and knowledge that we get about menstruation happens in the early years of our lives through the socialization process. But there are different parts in the menstrual cycle and the development of a woman's life that changes the way that she experiences the menstrual cycle. So this knowledge must also encompass these changes in our lives. And then the second area that is important for menstrual hygiene management is the material environment. So what is around us, including the resources that we have access to or do not have access to. So these are the materials to collect or absorb the menstruation blood or the menstrual blood. So essentially, we're talking about menstrual product. So most women in Malaysia use a disposable sanitary pad, right? So this is an example of a menstrual product or menstrual material. It is able to collect and absorb or absorb menstrual blood. But there are also other types of menstrual products, including tampons, menstrual cups, menstrual disc. There are also now reusable cloth pads and so on. So that's one, the menstrual product. And then, of course, we have the menstrual facilities, or the facilities that helps women manage menstrual hygiene. So this is wash facilities, basically clean water, sanitation, hand soap, as well as disposal management, especially when we're talking about using disposable sanitary pad, because it must be disposed of. And then the disposing of it must also ensure that we are thinking also about the environment and also the dignity of the women as they are trying to manage it. So the material environment must give women the experience and also the capacity to privately and hygienically manage their menstruation. So when we say privately, we mean access to toilets that have doors that can be closed, that are covered, for example, or the ability to change their menstrual product in a safe and covered way. So we're thinking about spaces that women live in. So when we are imagining women and thinking about women, we must remember that although we classify women as a group, not all women experience same lives, like we mentioned earlier in the Bobo citation. So some women are living in urban areas, some women are living in rural areas, some women are living in remote areas. There are also incarcerated women, for example, in detentions, in prison, women who are refugees, women who are experiencing climate disasters or natural disasters. So we're thinking about all of these women's experiences because menstruation does not stop for pandemic, it doesn't stop for war, it doesn't stop for genocide, it doesn't stop for a flood or an earthquake. So it just happens. So are women able to access all of these material environments in these different situations? And then, of course, the third area is the social environment. So what do we mean when we say social environment? So social environment relates to the social, political, and cultural context that women live in. So this may include taboos, myths, or stigmas around menstruation, menstrual hygiene management, and including how it is perceived by stakeholders as well as experts or people who are able to make changes. So we're thinking about taboos and myths that not only affect menstruators, but also people around them and how they address menstrual poverty. So I like this Hannigan et al. Definition of menstrual health because I think it is more comprehensive, and it also addresses the different layers of challenges that women and girls experience to manage menstrual health. So as we've seen earlier, knowledge or education and information about menstruation is really important. But this knowledge must be accurate, number one. And that's really important because sometimes through socialization process, knowledge or information is passed on, but they are not accurate. The second one, it must be timely. This is thinking about, for example, girls getting their menarche or their first menstruation before knowing what menstruation is and understanding what happens to their body. So we can imagine a young girl suddenly bleeding, and she didn't know that that's going to be part of a normal process for her as she reaches puberty or menarche. So this would be an alarming experience to suddenly be bleeding, right? So it must be timely. And then at the same time, it must also be age appropriate. So we are thinking about the different changes that women go through in our lives. So maybe it is not appropriate to tell young girls about the processes of perimenopause and menopause because it's not appropriate for that age. Maybe for them, it's more important to talk about puberty, the arrival of menstruation, menstrual cycles, and then how to manage their menstruation. And then as women go through different life course or the different developments in their lives, including the reproductive years.
You are on time. Can you help me? I tried to join Zoom, but
Sorry, I think you are in our Zoom.
Okay, I think I just leave it first.
Okay. All right. So I think somebody was trying to get in. Hopefully someone is helping her. Okay. So it is thinking about the changes that we go through in our lives and ensuring that all women and girls have access to these three things, which is accurate, timely, and age-appropriate information about our menstrual cycle and our menstruation. And what are the changes that we expect to happen? And this is also very important when thinking about women approaching perimenopause and menopause, because big changes also happens towards the end of the menstruation. And then the second one is materials and facilities. I mentioned this earlier just now, and that was really some of the things that we are talking about, right? Access and use of effective and affordable menstrual materials, which was the menstrual product. And then, of course, the supportive facilities and services. So just now I talked about toilets, having access to clean water, hand soap, and disposal management. So if we're thinking about toilets, I want us to also think about not just toilets at home, but also toilets where women go. So we're thinking about public spaces, we're thinking about schools, education institutions, we're thinking about workplaces. Do all of these spaces have the facilities women need to manage our menstrual hygiene and also our menstrual health? And then the third point is health services and resources. So we did also mention this on the menstrual health slide just now, but this is a more in-depth look into what is needed. So this includes timely diagnosis, treatment, as well as care for menstrual cycle-related discomfort and disorders. So we know that we have an understudied area of the menstrual pain, including issues of endometriosis, for example. What is normal levels of pain? Do women and girls know when they have to go to the doctor? What are their health-seeking behaviors? And for example, our medical professionals and researchers doing more research and expanding the research on issues relating to menstruation, and are they being addressed when we're talking about diagnosis? And at the same time, when we're talking about diagnosis and treatment, we're also thinking about the different marginalized groups of women and whether or not they can access these resources. So it could be distance between where they live and the nearest medical center, and also how much resources would they need to spend to get to a medical center. Say, for example, they may live in a remote area, the nearest clinic is 30 minutes away, or they are in a war-torn area. So maybe there is no access to proper medical care, or they may be competing with, or there may be a lack of attention given to menstrual health due to prioritization of other health issues. So these are all the challenges that can come through the health and services, or health services and resources. And then on the right side here, actually, I'm highlighting more on the social cultural context of menstrual health that deeply impacts the other half. So while they may seem separate, the positive, respectful environment and inclusivity criteria actually deeply impacts the ability and also access for women and girls to get knowledge, material facilities, and also health services, because it affects our ability to do research or our interest to do research, the policy making, and the implementation of the other things. So menstruation and menstrual health and hygiene must be existing in a positive, respectful environment where it is free from stigma, and the women who experience menstruation are also free from psychological distress that are affected by maybe stigma related or taboos related to menstruation. Excuse me.
Doctor, if I may ask,
Yes.
what are the examples for stigmas that you mentioned just now?
So as we talked about earlier, different social environments and cultural environments have different understandings and beliefs about menstruation. So in some societies, we may see it in the form of stigmatizing leaking. So when women have leaking and it's on their blood, they may feel so there are studies on anxiety related to leaking. But in some other cases, maybe some of you have watched this movie called Batman. In some cultures, women are separated during their menstruation. Please excuse me for a while. So in some cultures, women during their menstruation are not allowed to participate in spaces or some social activities. So we say that this type of stigma may be a bit more severe. And then of course, inclusivity is really important.
How about in Malaysia?
In Malaysia, we have some practices and some cultures that may relate to issues of stigma. For example, we know that girls in school, for example, experience some form of bullying when they have leakages. So these are some studies that we have. We don't really have a lot of studies on stigma relating to menstruation, but I will talk about it in a few slides on this concept of the culture of concealment. So just a little bit more, and I will get on to your question. Okay, so just to get to the last part of this slide is a little bit long because I think it sort of gives us a good framework of what do women need and what are some of the challenges that women experience or girls experience in the ability to manage menstrual health and hygiene. So when we talk about inclusivity, we're ensuring that women and girls are able to participate without exclusion, without restriction and discrimination, and also free from coercion or violence. So for example, in thinking about ideas about women being weak or women being emotional and unable to take on leadership roles because they menstruate. This is an example of a form of discrimination and exclusion of women or restriction of women. So those are issues relating to inclusivity. Now, I want to bring the concepts of multidimensional poverty and gender inequality with period poverty, because I think these are two concepts that relate closely to period poverty, but often we don't discuss it in this way. So we know that multidimensional poverty is the multiple deprivations that a poor or person in poverty experiences, acknowledging that poverty is not just an economic issue. It is not just a deprivation of the lack of monetary resources, not having enough money. We also know that the experience of poverty includes deprivations or may include multiple compoundable deprivations, including health, education, infrastructure, and living standards. And often they add on to one another. That's why we say it's multidimensional. It's not enough to sometimes give people money for them to get out of poverty. Similarly, when you think about menstrual poverty, it's not enough to provide pads to get women out of period poverty, right? So we're thinking about it in that sense briefly. And then gender inequality is a concept or the idea that we understand that there is some form of structural inequality that women experience based on our gender. There is some disparity based on our gender, maybe that affects our access to resources, our access to opportunities and rights. And obviously, in the context of period poverty and menstrual poverty, women are the ones that experience menstruation and experience the consequences and impact of menstrual poverty. And this is a issue, or gender inequality comes from the combination of how we live our lives, including social roles or gender roles, the norms around being women, the norms around menstruation and menstrual management. And then also we're thinking about power dynamics. Who has or the right to make decisions about purchasing menstrual products at home? Who makes the policies? Who decides about employment issues? Who is giving out leave for women who are in pain for menstruation? So we're thinking also about power dynamics, okay? So where do we see intersections between period poverty and multidimensional poverty? So I think the first one we can see obviously is issues of health. So there is health deprivations that is the result of menstrual poverty, and that relates specifically to the lack of access to infrastructure, for example, products, right? And then the lack of the ability to manage menstruation properly in poverty will have an impact on the outcomes of health for women and girls. So this includes using unhygienic materials. So we have reports, for example, in the Malaysian case by NGOs that women and girls in areas affected by poverty or when they experience poverty that uses, for example, coconut husk or old socks, old materials, dirty paper, for example, as a form of material for their menstrual product, example. So this unhygienic material, of course, can and may result in infections and other health issues or health complications. And then the second form of deprivation that is related to the multidimensional poverty is the educational deprivation. So we also have reports of women and girls especially missing out on school. And I've done a research on this as well. So not just in rural, remote areas, but also in urban areas, sometimes girls miss school or are unable to attend school because they don't have enough period products, or they don't have access to period products. So in order for a girl to go to school, she must have sufficient menstrual product for her to change so that she can participate in society in this way. And we know that education deprivation or the lack of ability to go to school would have long-term consequences for women. So Hannigan highlights the increasing dropout rates, but we also know that it would lead to increasing or the loss of life opportunities. So in my study, we found that there are girls who don't miss out on the whole menstrual cycle. They would go to school on some days, but they will miss out school on some days. So maybe in a month or in one cycle, they won't go to school in the first 2 days of their periods. They have pads in the urban context, but not enough. So on the day where it's a heavy cycle, they don't go to school. So they miss out school maybe 2 days a month. 2 days a month in 1 year is still significant in terms of loss of education, loss of opportunities to participate in activities at school, and so on. So we're also not just thinking about dropping out totally, we're also thinking about the loss of life opportunities due to these experiences. But even if and when women and when girls go to school, if they are unable to participate fully due to, for example, the lack of facilities at school, when they don't have comfort or they experience shame that affects their mental health, and therefore this also affects their educational experience or their ability to go to school effectively. And then, of course, the third is the economic deprivation. This is quite clear in terms of thinking about their ability to access the product, in thinking about the ability to access hand soap, for example, clean water. So this can, of course, not just harm their health, but also affect how they get through life and whether or not they can participate outside of the home. And then the fourth is deprivations related to social exclusion and stigma. So we'll look at this a little bit more later, but we know that when we talk about poverty, even we're just talking generally about poverty, we know that there is also stigma that is intertwined with the concept of poverty. But when we talk about menstrual poverty, it's not just social stigma related to poverty, but also related to gender. So when we talk about wealth issues or wealth inequality and poverty, one of the key drivers of unequal access to MHM, or just now we mentioned, is called menstrual hygiene management, is not being able to access these items or these things. For example, not having access to private, safe and clean MHM spaces. So toilets, covered toilets, so proper structures, living structures. So think about the homeless community, those living in refugee camps, thinking in certain rural remote spaces or even urban spaces where due to wealth inequalities or wealth gaps, people are unable to have proper infrastructure to manage their menstruation. There's no access to toilets, clean water, covered toilets, the structure is not safe, or women feel unsafe about changing their menstrual products, for example. So women and girls from households with less wealth are also less likely to have access to private, safe and lockable spaces for menstrual hygiene management, and also have less access to soap and water than those who live in a wealthier household. So we know that those who experiences more vulnerabilities in terms of wealth often experiences extra vulnerabilities when we look at their gender, when we look at their race or ethnicity, and also certain forms of social disparities. So there are some groups of people in our society that would have added vulnerabilities. This also may include disabilities as well. And when women are in positions of or are victims of violence or domestic violence. So when we talk about poverty, there is this concept called the feminization of poverty. So feminization of poverty is actually when there is an increasing representation of women among the poor. How does this happen? Because more often than not, poverty affects women and girls in more ways than it affects men and boys due to our issues of gender inequality. And then if we think about it, women are often caregivers who receive who take on unpaid care work and often have less social security. So think about women who stay at home to care for their children, to care for the elderly, to care for sick family members. They often do not have a monetary income, number one, and they're not also guarded or safeguarded by Social Security. But I think in Malaysia now we have introduced more ways for women to participate in our EPF program, in SOCSO program, but prior to that, or in a lot of parts of the world, women who are caregivers or doing unpaid care work at home often are excluded from this. So think about how in the long term, usually women do not have access to making decisions as well about their menstrual health because they depend on others to help them. And women are also the ones who become pregnant and give birth, and therefore they are also taken out of the workforce, or they take on more of the load to care for the next generation. So this sometimes create what we call a cycle of poverty, and where we see there are more women and girls among the poor than there are boys. And women also often face barriers in terms of accessing quality jobs. So we know that there is a gender pay gap. We also know that there are challenges for certain groups of women and girls in terms of education. Although in Malaysia, women have exceeded men in terms of education participation, but in terms of jobs and employment percentages, women are still lower than men. So we know that generally economically, there are unequal economic opportunities for women and girls. And then, of course, there are underlying gender biases and social norms that perpetuate discrimination and unequal treatment. So here we will get on to our discussion on the culture of concealment and menstruation. And this is based on the discussion earlier on stigma. So I'm bringing it back to what is this idea of the culture of concealment and how do we perpetuate certain beliefs about menstruation and so on. So we can hear this word concealment. That means we're trying to keep something hidden, keep something a secret. And I think at this point, we understand that what we are keeping a secret is the period or the menstruation. So the culture of concealment is something that is socially constructed. So we learn it, and then through the socialization process, we tend to internalize certain beliefs, and then we action it, and then we tend to perpetuate it without much thought or careful consideration. So unless we disrupt it and make changes, often it continues on within our society. In terms of our action, our interaction with one another, how we think, how we believe certain things, and then it may be also incorporated in our policy making, our education, the knowledge that we share with each other, and so on. So that's why we say it is a social construction. In our societies, generally, not just in Malaysia, but also a lot of parts of the world, women and girls, or especially at the young age, girls have been taught about the idea of hiding their menstruation. So often the socialization process starts with the family, and then we also see it in schools, we also see it in media that tries to teach girls and women that menstruation is something to be hidden, and especially this is only for women, and it's only the space for women. And I want to highlight that when this happens, it doesn't just affect girls' perception of menstruation and needing to hide it, but also it affects how men and boys behave around menstruation, as it is something to be hidden from them, something that they are not part of, therefore something that either they should shy away from, or if they participate in it, it is considered something that is inappropriate. So we're not just looking at how women and girls learn about it and receive these ideas and how they interact with it, but we're also thinking about how do boys and men are socialized in this process, and therefore how they feel it is appropriate for them to respond to it. So this socialization process of hiding it and thinking that menstruation is something to be hidden often promotes this idea of feelings of embarrassment or shame. Sometimes it is not shame, sometimes it's just being embarrassed, right? So we still live in a society where there is a strong culture of concealment, and that often we do not discuss it. And in our society especially, it is not something that we often openly discuss. But I think among the younger generation, it is becoming more normalized. So we may be going through an experience or a phase where the younger generation is more open to discuss it, while we have a contradiction with the older generation. So this is something interesting to observe as well. The culture of concealment relating to menstruation is also seen in how we think about etiquettes around menstruation. Like, what are things that we're allowed to do? What are things that we're not allowed to do? So this is what I call the unspoken rules about menstruation. So think about how girls change their sanitary pads in school, or if they don't have sanitary pads in school, how can they look for it, right? So we're thinking about asking from their friend, or how do they bring their menstrual products or pads to the toilet? How do they ask to be excused during class time to change their sanitary pads, for example? So there are all of these unspoken rules about what they can do and what they cannot do. How do they do it? And there may be also additional cultural rules about exclusion relating to menstruation. So for example, women not being able to cook food while they are menstruating, they're not able to enter certain spaces when they're menstruating. So when we talk about the etiquette, we may think about also certain ideas about and how interesting these are in terms of how early women and girls, especially girls, learn about what they can and cannot do. Just like, maybe I can give an example that girls often whisper to their friends if they need a sanitary pad, and then they will hide the passing of the sanitary pad to each other. It's not something that they would do. Say, for example, if you ask your friend for a tissue, it is a sanitary product, right? That you would ask your friend to pass you a tissue. You can do it openly. You can ask openly and you can pass it on openly. But for women and girls, often they will whisper it. So there is concealing in the talking about it, and there is also the concealing in passing it. And they often take it at the back of their hand or at the back of their body or behind something, and then put it away. And sometimes the menstrual product itself is covered and not visibly seen, right? So this idea often, or these behaviors, we say are as a form of gendered labor or gendered work that only girls have to learn how to do, and we learn to perpetuate it. And this idea also reinforces idea of women's oppression and also secrecy around what is normal and what is part of our biological processes. Now we move on to stigma and shame. So this is where I wanted to highlight just now. So from the sociological perspective, when we talk about stigma, what we are looking at, actually, we are referring to a certain attribute that is considered discredited by our society. So it is something that is not seen in a positive way in our society. And because we have this attribute, therefore, people do not look at us in a positive way. So Irving Goffman describes stigma as the gap in or between a person's or an individual's virtual social identity, which is how people perceive us. Okay, this during this time, virtual identity is not relating to our use of social media. So it's referring to how people perceive us or how society perceives them. Okay, and also the individual's actual identity, who they are. So when there is a gap between these two, then there is what we call the spoiled identity. So this affects how people accept us and how people interact with us. So in the context of menstrual stigma or the culture of concealment, okay, menstrual stigma, they refer it as a form of hidden stigma. So often women don't talk about or don't say menstruation out loud. So maybe you can think about it. What is the idea, or what is the discrediting idea about saying the word period or saying the word menstruation, right? So generally, the idea of menstruation or leaking or talking about menstruation out loud refers to the idea of dirtiness or weight, that menstruation is dirty, therefore if you are leaking, you are considered dirty. Or if you have menstruation, you're not in a clean state, you're in a dirty state. So therefore, hiding it makes sense because we don't want people to think we are dirty. In the same way, sometimes menstruation is also sexualized, or menstrual cycle or the blood is sometimes also sexualized. So I can give an example. Sometimes girls are scared to highlight the issue of menstruation because then they can be considered as, or they are objectified. So therefore they want to hide that part, especially younger girls. So we have cases where girls do not want to use reusable cloth pads, or their mothers don't encourage them to use reusable cloth pads because they live in houses where they have to hang it where it's supposed to dry. So the reusable cloth pads looks like a disposable cloth pad. So in order to clean it, you have to wash it and hang it under the sun. So in these community spaces, the hanging area is visible to other people. So when you hang it, then people can see it. So therefore, people know that you menstruate. Therefore, it is understood that you are now considered as a big girl, or an objectified idea of a woman. So these are examples of the negative perceptions relating to menstruation. Of course, this can be disrupted and this should be changed, but this is the experiences that women have relating to stigma on shame. And therefore, that's why it's really important to break the stigma, to end the stigma on menstruation. And this stigma is not just based on what others do to us or how the individuals experience this stigma, but over time, people tend to internalize the stigma. So women and girls often internalize and police themselves. So they hide it from others. So even if there is no other women there, or their mother or their teacher is not there, they have internalized this idea of shame and stigma relating to menstruation. So they will continue on. So that's why we find that what their mothers teach them in the early years continue on and perpetuate until even after they go through menopause. So the shame or the stigma about concealing and the culture of concealment continues to perpetuate itself through generations of women because of these self-policing behaviors. So they manage it themselves after they have internalized the socialization process. And then, of course, finally, we also see the culture of concealment through language and how we use certain types of language. So when we talk about menstruation, sometimes we don't use the term period or menstruation, right? We use another term. So I put some pictures here. So maybe you are familiar with some of these pictures. So sometimes you say it's a full moon, or red flag, or my friend is here. Or maybe sometimes use the word it, or use other words to say, or instead of mentioning the word period or menstruation, we use other types of words. Similarly, the pad or sanitary pad in the Malaysian context, we have gathered some examples like roti. Instead of saying period, instead of saying sanitary pads, they say roti. Or do you have a different kind of product instead of saying what it is. So language is also used to hide or to conceal menstruation. So in this way, it is considered a form of linguistic concealment. Therefore, it continues to reinforce the idea that menstruation is something to be hidden and something that is stigmatized or shameful. So going back to bringing this idea of multidimensional poverty and also gender inequality and how it affects menstrual health and menstrual hygiene. So the combination of these two things, we know that number one, taboos and stigma or misconceptions or misunderstanding around menstruation will have an impact in unnoticeable ways, which is it affects certain types of restrictions and exclusions. But it doesn't focus then on what women actually need, which is clean, safe, and private spaces. So the focus tends to look into other things about how do we hide it, how do we keep it hidden, and so on. And in the same way, the gender inequality aspect that relates to the concealment affects also how much research is done on menstrual poverty or has been done in the past, and how it changes into or it can translate into policies. So the stigma around menstrual poverty also results in menstrual poverty and menstrual health and hygiene being an under-researched area. So researchers are also human beings and social beings who exist within the social context, and they are often not excluded from experiences of socialization that are internalized. So they themselves may feel discouraged from studying these types of sensitive topics. So when there is a lack of interest, there is a discouragement to study a particular topic. Therefore, that topic would not have comprehensive data. Similarly, we find that there is no prevalent study on menstrual poverty in Malaysia. There is not a lot of menstrual poverty prevalent study in a lot of parts of the world. So this not just affects how women experience on a day-to-day process, but also affects the types of research that are there and how often and how much we invest in these types of research. And therefore then affects policy decisions, whether we are making informed policy, data-driven policy. So if there is no data, then there is no data-driven policies, right? So, and at the same time, when we're talking about research and education about menstruation, we shouldn't just focus on the aspect of education alone, but also to remember that the focus is not just infrastructure, education, and healthcare, but also in thinking about some forms of menstrual disorders that often do not have enough work on it. And this is including endometriosis or the abnormal uterine bleeding, because it actually affects more women than we know, and how we can address these issues. So I suppose to end the session, I think when we talk about menstrual poverty, the idea is not just to focus on menstrual poverty, but rather to push for an agenda for change. Essentially, it is trying to highlight that we can achieve a form of menstrual poverty, but it requires a whole society approach. Apart from addressing the public and the public awareness and also education, it is also raising awareness and education among experts and also researchers who can make a difference in terms of producing data, in terms of analyzing data, in terms of thinking about innovation that can help for better inclusive policies, new product development, for example, in order to ensure that all women and girls have proper access to menstrual hygiene and health that allows us all to participate equally in society, therefore contributing to a better society in general. So that is all from me. I'm going to pass it back to Izzudin. Thank you so much.
Okay, thank you, Dr. Fatimah. Wow, this is, as a man, this is my first time listening all of this information, and it's a new knowledge for me. So, for the participants, you can ask question in the chat box or open your mic to speak and ask question to Doctor. But before that, I want to ask you a question, Doctor, because when we talk about culture of concealment, all right? Do you think it's good or bad? Because I think, in my opinion, it is good to conceal it first, because the people, especially the men, they lack awareness on this period poverty or something like that. So they will continue to be stigmatized by the men. So I want to know what is your opinion of the culture of concealment. Yes.
I think number one, I believe that education about menstruation should be taught not just to women and girls, but it should be taught about men and boys. It should be taught to men and boys especially, because number one, we all live together, right? And at the very primary level, in our homes, we usually have both men and women, right? There is the husband and the wife, there is the father and the daughter, there is the siblings. And through living together, we must understand the needs of everyone in our home. And in the family, for example, parents often have a certain capacity or authority to make certain decisions. And we see this in children especially. Children learn from parents and depend on their parents for resources. So a child, in order for them to understand menstruation, they depend on their parents to teach them. And if they need certain menstrual product and facilities, therefore they require the parents to know what it is and to provide it for them. This is just thinking about the familial setting. So if a husband doesn't know what a wife needs to manage her menstruation, then he is not able to provide it, nor is he able to support her. And he is not able to interact with her in the right way. And if a father doesn't understand it and he doesn't know what the daughter needs, then he is also unable to do the same. So this is just very basic familial institution. But think about it in the broader setting, right? In the societal context, at school, at the workplace, in terms of policy, how much investment do we put in terms of our policies relating to women and girls? Thinking about public spaces, toilets that are in public spaces. So these are all related things, and we all live together as women and men in societies. Therefore, the education of women and men must be done together. So it shouldn't be that this is just an exclusive knowledge for women and girls. So I think that's number one. I believe that there is more harm in the culture of concealment, but I also want to perhaps share my opinion. I don't think that in a world of oversharing, maybe we're not having to overshare. So we don't really need to tell people when our menstrual cycle is. We need to tell certain people, for example, our spouses should know what is our menstrual cycle like. Our doctors need to know, but it is not our responsibility to tell everybody. So it is not to conceal it because it's stigmatized. That's definitely something that I disagree with because it creates more harm. But it doesn't mean that we need to share it with everyone. There is no, for example, need for us to share it with everyone because that is also something that may be very private to us in terms of our body autonomy.
Yes, thank you, Doctor. I very agree with the statement just now. The role of the man is also important in touching about these issues of period poverty. So we also have question in the chat box. The first one is from Faradin. Salam, Doctor. What is your saddest encounter when it comes to period poverty in Malaysia?
Okay. This is not my own personal encounter, but this was shared with me through a friend who works in an NGO. So it was actually the story of a young girl. So she lives in Sabah, in a remote area. So she, because of the social context that she lives in, as well as the economic context that she lives in, she is unable to access menstrual product and facilities because where she lives has no access to clean water. There is no access to a covered toilet. So the toilet is just like a box. The top is open and the bottom is also open. So even when they go to the toilet, the door doesn't lock. And you can see the legs of the people in the toilet. Okay. And then at the same time, she was 9 years old when she experienced her first period. And because she had it earlier than most children, her parents were angry at her for getting her period early, which is not her decision, nor was it her choice. It happens when it happens, right? Women and girls do not choose when menstruation happen. And I think there are still a lot of men or boys who don't know this, that we do not control when the blood comes out. Unlike going to the toilet, for example, for defecating or peeing, for example, urinating, we can sort of hold it. But with period flow, it flows when it wants to flow and it's not up to our control. So her parents were upset at her for getting her period early because now they have to think about her going to school. then because they have to buy sanitary pads for her in order for her to go to school. So what happened to her was they took her out of school. There is no sanitary pads for her to use anywhere at home, so she's just bleeding. So she just wears like kain batik and just bleeding. So there are patches of blood on her kain. And then because she's young and in that context and in that society and culture, she was asked to marry early because she no longer goes to school. So what is expected for her is then to experience or to be married off. So we can see that impacts of menstrual poverty in this context, which is also a form of multidimensional poverty, affects the girls because they're not able to access education, and then she's then having to experience child marriage. So this is like a really severe form of menstrual poverty. So we're thinking about long-term impacts for her and the cycle of poverty and how she has to manage life relating to this. And of course, it cannot be said that this is just a menstrual poverty issue. It is always intertwined with other issues of poverty and so on. Yeah.
I hope that can be a lesson for all of us. So the next question is by Siti No Mazwan. Is it possible to provide dedicated room with washroom at school for the girls to feel comfort to change during menstrual cycle? The concept much like sick bay.
I like this question really because I think that women and girls have certain needs in terms of managing our menstruation in the toilets, right? But the infrastructure and design of toilets are the same. And sometimes it's really small for women and girls, the cubicles, right? Whether it is at school or in other spaces. So I definitely think that we can rethink about our spaces and how to accommodate these spaces to our needs. So this is an example of using our gendered lens. So I don't know if I'm not sure how it relates to like a sick bay, but in terms of changing menstrual products in the toilet, in terms of how we want to use it, I think there is definitely spaces for improvement. And I like that idea of us rethinking not just the product, but also the spaces and the comfort around spaces, because a lot of girls, even those coming from T20 categories or M40 categories, have reported that it is always uncomfortable to change their menstrual product or just to go to toilets in school. But I think it is also important to highlight that the Ministry of Education did upgrade the toilets, I think last year or earlier before that, to address some of these challenges. So I hope that it is still good and that there is a pathway for girls to report, for example, broken doors or lack of sanitary bins there. If there is no hand wash, I think a lot of the issues related not having access to hand soap in the school toilet also, and poor water flow.
I hope that answered the question, Nomazwan. Also, the next question will be from Zainab. Doctor, do you think it is important to all women to have application to track and increase awareness and knowledge about their menstrual cycle health, since the cycle might change sometimes? Because some people still manually track their cycle.
I think apps are an example of good innovation that helps support menstrual health and menstrual tracking. And I think some of the apps also include some information and facts and important notes about menstruation. And then there is also some algorithms or AI that help predict the next cycle and so on. So I think tracking menstruation and menstrual cycle is really important. But I also recognize that not all women and girls experience life in the same way. So maybe using an app is really good for people who have access to a phone, a smartphone with internet access. But for some people, maybe manually tracking is an option that they have. So tracking is good, whether it is manual or whether it is via an app. And of course, with better technology and better access to technology, often it helps women and girls better, right? Not just for them, but also for husbands to track their wife's cycle also and help with tracking the cycle, but also something that's good.
Yes, thank you, Doctor. And Doctor, do we have a specific policy about this period poverty?
So actually, maybe we can think about what are some of the things that can be done to address menstrual poverty. So we know that, for example, Malaysia was among the earlier countries to drop the pink tax or the tax on period products. So that was done, I think, in 2018. So that's one example of policy changes that affects period poverty. At the state level, Selangor was and is the first state to introduce a period poverty program at the state level. This includes educational program and the provision of sanitary pads. But a lot of the provisions of sanitary pads that have been done at the state level or other levels often focus on girls in school. Yes, these are important target groups and should be continued, but I hope that we increase it. At the national level, there was a budget provision in 2022, if I'm not mistaken, to give out sanitary pads. But currently, KPWKM through LPPKN runs more educational program because they believe that in Malaysia, the challenges are more towards education and knowledge rather than product per se. And then I am also aware that Kementerian Pendidikan are also working towards a more comprehensive view of menstrual poverty and how to support women and girls, to support girls in school with period poverty. So there are some work within our policy and at the national and state level initiatives that are working towards addressing menstrual poverty. So I think Malaysia is actually on the right track. As long as we keep going and we keep pushing for better policies to address it. Yeah.
Good to know that there are initiatives made by the government and people in power, right? But what about what can we do individually? Like all of us in this meeting, what can we do? Yes.
Right. I think the first one is always about raising awareness and understanding the issue. I think in Malaysia, we've talked about period poverty or kemiskinan haid a lot more now than we used to before. So in the last 5 years, it's been something that's spoken about more, but I think there are still people who don't know what period poverty is and what it entails. So some people have heard the term kemiskinan haid or period poverty, but most people think it's just about not having access to period products. So I hope that we have a better understanding in terms of the comprehensiveness of the issue and what it needs and what women require, including freeing from stigma, including thinking about access to medical care and also health-seeking behaviors. So a more comprehensive understanding of period poverty is needed, not just for women and girls, but also for men and boys. I hope that we can also create a healthy, safe environment when we talk about menstruation and period in our usual social spaces. So if we are able to educate boys, especially at a younger age, on how to understand and discuss menstruation in a safe, healthy, and empathetic way, then we will have a generation of men in the future that are able to also understand this and be able to empathize in terms of thinking about policy, in terms of being more inclusive in policy making, also in terms of just being a good human being, right? In an understanding half of the population. So that would be the first start. But as we are in an academic platform, and usually I'm invited to talk about this issue outside of the academic platform. So within the academic platform, I hope that we will do more research on menstrual poverty, not just in terms of looking at health issues and health behaviors, but also in thinking about economic perspectives and in thinking about innovation and design, in thinking about sustainable products and sustainable ways around improving menstrual poverty. So I think there is a large gap in areas outside of health that talks about menstrual poverty, but there is a gap there that needs to be filled. So within academia, I hope there will be more interest to look into period poverty.
Inshallah, Doctor. Siti No Mazwan just replied to your answer just now because the question about the seat being right. She said that, thank you. The question reflects my experience with my daughter in primary school. She preferred not to go to the toilet during school and waiting to do it in transit. Because I'm not sure for secondary student when there is no transit house practically for them. So I think there is a specific place just for the students with the menstrual cycle ongoing. Yeah, I think.
Yeah, so I did a research in Klang Valley with urban young girls in secondary school. So they did, in the same research, we found that the girls would never go to their school toilets. But this research was done in 2019 to 2021. So they would never go to the school toilet to change their sanitary pads. So they would rather wear a dirty pad for longer periods throughout the school day than to change it in the school toilet. So that tells us that there is an issue with the school toilet at the time. And this issue was also highlighted at an engagement with the current Minister of Education. So I hope that that was also part of the thinking when they improved the toilets in school. And I hope at this point, like I said earlier, that they not only have improved it, but there are also pathways for children in school to report when there is breakdowns of certain things, and they know what to and how to address these challenges. But also including really important, I think, as an everyday person, to educate our family and children on how to use the toilets properly so that we maintain these shared spaces, right? Because sometimes, unfortunately, the breakdown happens because we have not raised awareness and educate ourselves in terms of properly using our public spaces or resources that we share or spaces that we share with each other.
I think it must be because of the material environment in the school. So the school need to take note on this, I think, yeah. Do we have any more questions from the participants? Maybe another question? While we wait for one more question, Doctor, maybe you can explain more about the role of men in this period poverty issues. Yeah.
So I think what is interesting is, in my experience doing not just research on period poverty, but also advocacy work for period poverty, I find that in a lot of instances when men understand what menstruation is and what menstrual needs are, I have not experienced resistance in terms of willingness to support women and girls. So that has been my personal experience. It may not be true for all women out there, but generally, I think that is what encourages me to continue to raise awareness about menstruation, because more often than not in our society, men make a lot of decisions and they are often in positions of power, whether it be in the family, in the community, at the state level, or even at the federal level. So I can give some examples where it has been good and I've seen good changes. So I've spoken to men who are employers or bosses at corporate sectors who, upon understanding the issue and concerns, have made policy changes where they work, where they have employees in providing menstrual products, in terms of being more aware and empathetic for issues of menstrual leave. But I've also worked with men who have worked with NGOs in recognizing that menstrual product and clean water and also having disposable panties are really important things to put in packages that are passed to communities. For example, in the context of flood, right? We know that Malaysia experiences flood and displacement almost on a yearly basis, and it affects so many communities. Just thinking and remembering that in the package to be given to families that are affected, we should include sanitary pads and disposable panties, for example. So this is like something that's quite simple, but if we remind and tell men, then they are often going to do it anyway, right? And We also have examples like in speaking to parliamentarians, for example, and raising their awareness and how that affects how they address their community. So these are good examples, I think, in terms of how I've experienced talking to men and addressing men. And I've had also in a lot of the sessions where I do advocacy for period poverty, most of the people that come are women, but sometimes some men are forced to be there, or because their wife is there, they're there. But by being there, they often come to a realization of how important it is. So recently I had a talk with, I think, a larger proportion of men. And after the session, I had fathers who came to me. There was a single father who was asking me, my daughter has missed her period for several cycles. What do I need to do? So it's not always that in every family there is a woman or a mother figure. Sometimes it's single fathers who are raising daughters that also needs information like this, and they also need knowledge in order for them to take care of their daughters and so on. Yeah.
Yeah, Doctor. I believe it is important for men to learn about the period poverty also. And I think the next question is by Faradin. What are some of the amazing initiatives being done with regards to the period poverty in the global level?
Okay, so I think there are so many good work actually highlighted that I can highlight. There is one resource I think platform where they have developed modules for menstruation and talking about menstruation, as well as preparing modules for men and boys also. It's called Menstrupedia. I think they've reached 13 million people in terms of educating about period and untangling period poverty. There are also menstrual collective where people who work on menstrual poverty and menstrual issues come together. I also know that through the work of menstrual poverty awareness, there are more initiatives by NGOs who are now delivering menstrual products and raising awareness and giving education about menstrual cycle to refugee camps. For example, a few weeks ago, or no, 2 weeks ago, I think, I was giving a talk for Global Relief Trust, who is located in 12 locations around the world, for their new campaign called Code Red. So this is a new campaign that they launched. They are actually a UK-based NGO. So they are impressed by what we've done in Malaysia actually, and how far we've come as a country in terms of understanding menstrual poverty and addressing the different needs of menstrual poverty. So I think there is also that acknowledgement. There is a lot of work that are being done in Malaysia, and an awareness that is quite big compared to other countries as well. So maybe some of the highlights. Yeah, I will try to see if I can remember more. I think, Izzudin, your mic is off.
Oh, sorry, I didn't realize. So there is no more question. Okay, thank you. As we conclude today's discussion, it's clear that this issue of period poverty is far beyond just access to menstrual products. It is matter deeply rooted in poverty and gender inequality. Our conversation today has highlighted the urgent need for awareness and change by the community. Addressing period poverty is not just a woman's issue; it is a human rights issue. By tackling this issue, we pave the way for better health and education for everyone. Lastly, Dr. Fatimah, I want to thank you for the insightful sharing and to every audience for their participation in this session. I hope that this session will have a meaningful impact on all of us. Okay, thank you, Doctor, and I'm passing it back to Puan Suan.